Guys, this is Mubin. We are talking about the cardiovascular system hemodynamics. The lecture today is about the Reynolds number and the blood flow types, that is laminar and turbulent blood flow types. So let's look at them quickly here. First of all, the definition of the Reynolds number. Reynolds number is the best predictor of the type of the blood flow present in the system. That is the importance of the Reynolds number. And what does it mean? So before we go and see if the number is increased or decreased, what happens? Couple of things that we should understand is, first of all, what is laminar flow versus turbulent flow? Laminar flow is when the blood or the fluid is moving through a pipe in a very calm, layered fashion. Normally, when a fluid is moving through a pipe through a laminar flow, what happens is the central layers are moving faster. And then as you keep going towards the peripheral layers are moving slower. Why? Because peripheral layers are experiencing drag by the wall. They are experiencing resistance at the wall. Then that resistance reduces on the inner layers. It reduces even more on the inner layer. And as the drag keeps reducing, the flow keeps increasing. This is called the laminar flow. So if you actually see it through some way of freezing the blood and see how the laminar flow is going on, which you can't do, you would see that the central portion is going the fastest. Then there is a lamina or a layer around it that is going slower, and so on. So that is a laminar flow. It is the calm flow. It has many important properties. What is the most important property for us? Number one, laminar flow does not damage our blood vessel walls. Number two, it allows the margination. You may have read about margination in the immunology. Margination means what? It allows the blood cells to sit down near the blood vessels, to aggregate there, and then get out of there if need be. Margination is also the process by which platelets are sitting on the sides of walls of the blood vessels, and they're not doing anything. And as they are needed, they become activated and separated and come out. So margination process needs a laminar blood flow. On the other hand, the turbulent blood flow means, if you see a waterfall falling, you see that turbulence there at, the crazy and chaotic water that is flowing. Or if you see a fast river going and you see the eddy currents and you see the whirls and that high energy flow is called the turbulent flow. In our body, naturally, aorta usually has turbulent flow in it. Turbulent flow normally contains eddy currents in them. Eddy currents. And eddy currents are those whirls, those high energy loops that are forming in the blood. What is the problem with the turbulent flow? Is that a good thing or a bad thing? Well, to an extent it's okay, but what happens is that when the blood continues to hit against the vessel walls, it keeps damaging them because it keeps stretching. It's like if you take a balloon and you keep stretching it, by slowly the elastin in the vessel walls, that starts breaking, that starts fragmenting. So if I take this vessel and if I show you the diameter, if this is the cross section of it, you know that aorta has about 50 layers of elastin and smooth muscles, right? In its tunica media. Now with every stretch, the elastin fibers will break and they become smaller and they become fragmented. It happens throughout our life. You can increase that damage by creating eddy currents and the turbulent flow. That would stretch the aorta enough, just like a balloon, that finally aorta would give up and it's not going to be compliant anymore, and the systolic and diastolic blood pressure or the pulse pressure would start reducing. So remember this, that the turbulent flow is bad and laminar flow is good, not only to protect the vessel walls, but also for the margination and normal physiological functions of our blood. So now let's look at Reynolds number. What Reynolds number says is, if this number is low, I'm not talking about the formula yet, if the Reynolds number is low, that means laminar flow has increased. There is more laminar flow, more smooth and calm blood flow, better. If Reynolds number is higher, that would mean there is a tendency for the turbulent blood flow, and you as a doctor have to figure it out, that why is it turbulent. Now, before we go into the equation, one more thing, and that is that murmur and bruise related to the turbulence of the flow. So if you put a stethoscope on aorta or on carotid arteries or on heart, you might hear murmurs. What are murmurs? Murmurs are the sounds of blood splattering onto the rest of the blood, and the turbulence and the eddies created there, they move against the heart's walls, or they vibrate the walls. So let's say this is heart. The turbulent flow of blood here causes vibration in the heart's valves, which you pick up through your stethoscope and you hear, and that is a murmur. Similar thing when it is happening in aorta or it is happening in the large vessels like carotids, you can actually hear that with your stethoscope. That means somehow something has gone wrong with the blood. So what has gone wrong with the blood? Let's look at it. Reynolds number has some parameters above and some below in this equation. Look, what is the denominator? Viscosity. So first let's talk about that. What that says is that viscosity, if it increases, Reynolds number reduces, and we saw that Reynolds number reduction means laminar flow. You can actually think about it. How about honey versus water? If honey is moving, would it move slowly and calmly and quietly and in a laminar flow? Yes. How about water? No, compared to honey. So the more viscous a fluid is, the more laminar flow or smooth flow or calm flow it will have. It would also mean it would flow slow. So maybe you don't want to create hematocrit so much that the blood flow becomes so slow that now the nutritional needs are not met. On the other hand, if you reduce the viscosity by doing anemias, for example, then the Reynolds number would go up. That would mean turbulent flow, and you would start hearing murmurs and bruits. How about this side? What are the things here? Density of the blood, velocity of the blood flow, and diameter of the blood vessels. Look, why is aorta normally having turbulent blood? Because the diameter is small, velocity is high, viscosity is the same, right? So aorta, compared to the smaller blood vessels which have smaller diameter, has highly turbulent blood because the Reynolds number is high. But for any blood vessel, if you increase the diameter, or if you increase the velocity of the blood, or if you increase the density, that would increase the Reynolds number. These are directly proportional. These are the inertial forces. They are causing inertia in the blood. When inertial forces would increase, Reynolds number would become big. Increase Reynolds, bigger number would mean turbulent flow. So Reynolds number, once again, is the best predictor of the type of blood flow that you would expect. That simply means if a patient has anemia, then the Reynolds number would increase because viscosity has reduced, because hematocrit has reduced, and that would mean the patient is now experiencing eddies and turbulences and bruits, and blood vessels can be damaged, aneurysms can be exaggerated, hemorrhages can occur. So this is an important number. Thank you.